In a perfect world, every IVF patient would get pregnant in the first IVF cycle. So, what are some of the things which you can do to maximize your chance of getting pregnant? Now, obviously, you can't set up your own IVF clinic, you can't set up and do your own IVF treatment. So, what else can you do? And the good news is there is something you can do. And what you can do to maximize your chance of getting pregnant in the first IVF cycle is finding a good IVF doctor. This is the only thing which is actually in the IVF patient's control, isn't it? Because once you find a good IVF doctor and follow his instructions, you're sorted. He'll tell you what to do, he'll superovulate you, he'll make the embryo, he'll do the embryo transfer. But it's equally important that you know how to differentiate between a good IVF clinic and a bad IVF clinic. And the reality is the number of bad IVF doctors is far more than the number of good IVF doctors, and you can't afford to take a risk. And you need to do your homework, and you need to learn to be able to differentiate between a good IVF clinic and a bad IVF clinic. And the good news is it's actually very easy to do this. You don't even need to go to the clinic to find out whether it's good or bad. You can actually pick up a phone or you can send an email to the clinic and ask the receptionist, do you provide embryo photos to all your patients? Do you do blastocyst transfers for all your patients? And do you do only single blastocyst transfers? Now, if the receptionist has no idea what you're talking about, that's a red flag. If the receptionist says, yes, we do only single transfers, we do only blastocyst transfers, and we provide photographs, you know you're in a good clinic. And that's what you need to focus on. Because once you're in a good clinic, your chance of getting pregnant are much higher.